Good morning, and thank you both doctors for all your good work. And not to monotonize this discussion on members wearing masks, but I would, Madam Chair, I would respectfully suggest that our colleagues who do not want to wear masks, who we've heard from today, ask their colleagues who have not got vaccinated to get the vaccine. Because, I think I speak for most Americans who have been vaccinated, and we don't want to wear masks, but we do not want to be sitting in small areas or with people who are refusing, who know better, who are refusing to get vaccinated. Uh, uh, so my next question, Doctor, either of you can answer this, is what is expected when we're going to need boosters for our vaccinations?
Thank you for that question, Congresswoman, and congratulations on your grandbaby, who I think was was pending as we last spoke.
Yes, he's here. Thank goodness. Something good came out of the pandemic.
On the topic of boosters, I think that it's really important for us to understand several things. First, if you've received 2 doses of vaccine or you're completely vaccinated, right now you don't need a booster. You're protected, or at least the data that we understand now for the general population implies that you do not need a booster right now. I think all of us recognize that we don't want to be back to where we were again. And so we would like to study this. We are studying when we might need a booster. And in fact, that gets back to what are the true correlates of protection. We do know that antibody levels over time, we've seen they wane. And so the question is, when they wane, are these people still protected? What do these quantitative numbers mean with regard to protection? We also know, importantly, that we vaccinated first our most vulnerable. We vaccinated people who are in long-term care facilities. We vaccinated our elderly. We vaccinated people who might not have had the most robust immune response to start. And so we are looking at the timing of when boosters might be needed. Will it be 6 to 9 months? Will it be 9 to 12 or 1 to 2 years? We've seen data from SARS, that the SARS-1, that have demonstrated reinfections after 2 or 3 years. That's after natural infection. And so I think the most important thing is we certainly want to be ready. And so that's where we are right now.
That's good. Do you expect, though, that the booster, the next shots, we're going to be able to get them like with the flu shots, not having to go to mass sites and things like that?
I think one of the things that's really important to recognize here is we don't have an adult immunization structure in this country. We haven't. We have a childhood immunization structure in this country, but we do not have one for adults. We don't have a mechanism to do this right now. And among the reasons for the funding is to develop and bolster an adult immunization structure in this country for flu shots, for COVID vaccines if we need them again. That would be the vision for Shingrix, for all the other, for tetanus when we need tetanus updates, for all of the things. We don't have that mechanism right now.
Well, thank you. That's a good idea, because our rollout in Florida of the vaccines was chaotic. I said it was like the Hunger Games here. So I mean, it was frightening. I think part of our population that really suffered were the elderly, and just interested in whether you're doing any work to address, how we handle these kinds of situations with our elderly population. There was so much isolation and depression.
I think you're noting the elderly specifically, and I totally agree. The isolation here had been so challenging, and in long-term care facilities, so devastating to watch. But I think you're raising a larger issue too, which is the mental health of this nation has suffered. And so we are doing a lot of work in collaboration with SAMHSA to evaluate mental health related issues, to look at issues related to suicide, to do more surveillance, and to do outreach with interventions that are data driven, that have toolkits provided by the CDC for how we can do outreach in these communities with community workers, to really do evidence-based science in mental health across the age spectrum.
And real quick, talking about toolkits, how about in terms of ideas for communities on how to increase vaccination rates. Is there a place that our health departments can go uh, to get different ideas or strategies?
Yeah, thank you for that. We have an extraordinary number of resources. We have vaccine confidence consults. You can call the CDC and get a vaccine confidence consult. We have through HHS the We Can Do This campaign. It's 5,000 community core. So if you have a group that NASCAR speaks to, you can go get your vaccine and then take a ride around the Talladega track. So there's lots of different ways to engage with this community core through the wecandothis.gov. I would really encourage your state departments to engage these community core organizations, be it NASCAR, NFL, country music, or infectious disease societies of America. Faith-based organizations can really help do the outreach so that people are talking to people they trust.
Thank you very much. Yield back, Madam Chair. Sadly, as we are speaking here today, there is a mass shooting happening right now in California, in San Jose. Madam Chair, I just want you to know that I actually live in Florida. I don't know if you knew that, but I do. I
know.
There have been so many questions. So to our guests, so thank you very much. If this has been asked, just say, okay, you missed it. This whole issue of the vaccine passports is starting to become a little controversial, especially in my state where I live, Florida. And I would just like to get your feedback on that, on the use of requiring, vaccine passport to go into certain establishments or cruises or so forth.
So the federal government has made the decision not to be the leader in vaccine passports, but has said that local communities, private sector may use it for their industry if they so choose. I can envision that there would be certain sectors where this would be incredibly helpful. And for example, cruise ships, I think, would be one of those where where cruises would like to be able to know the status of of the people who are taking a voyage. What I will say is that the most important thing is that people get vaccinated. And if there's a lot of people who are getting vaccinated, the utility of this passport, in fact, if everybody gets vaccinated, the utility of these passports is nil, right? So really the most important, the reason that we even have to have a discussion about passports is because people are not getting vaccinated. But if we can get people vaccinated, then the importance of these passports really diminishes entirely, or these verification mechanisms really diminish entirely. Yeah, I'll just stop.
Okay. And if you could get us, maybe someone on the staff can get us that confidence hotline number, that would be helpful.
Be happy to do that.
Sure. Yeah, I'm going to just switch the subject for a moment, which I want to talk a little bit about domestic violence, because I know that you have a program, I think it's called Delta. You also manage the rape prevention education formula grants, and I'd like to ask you a little bit how that is going, what kind of progress is being made.
These are such difficult issues for the individuals involved and those who love them. There are, CDC's been developing technical packages, the toolkits of what we know works, the evidence base, and facilitating that to be used by communities around the country. And we have funded additional programs to sort of scale up these efforts. Things are different in one place or another, and sometimes, whether it's rural or urban area, the nature of the challenges are complex. The team working on this is incredibly dedicated and empathetic in their carrying out the research efforts, but mainly what we're doing is supporting programs to implement evidence-based strategies.
Thank you. I'll give one a softball question. I know we've been talking a lot about COVID and AIDS and other diseases and so forth, what, in your opinion, are the top healthcare issues that face Americans today?
Um, I'm not even a good hitter, but I'm going to take a swing. Um, we need to bolster our public health workforce, our public health infrastructure, our workforce, our data, our labs. We need to work on health equity in this country. Everything that we do has to be founded in health equity in this country. We obviously need to get through this COVID-19 pandemic and get everyone vaccinated. We have a lot of work to do in opioids. We have a lot of work to do in HIV. We have a lot of work to do in mental health. We have a lot of work to do in health losses that we saw during this pandemic. 11.7 million childhood vaccinations have not been given. So I look forward in leading this agency through this pandemic and to address all of the public health infrastructure of this country.
Thank you so much, everybody. I'm going back to the beaches.
Wear sunscreen.
Very good.
Maybe
Take
this
care of
weekend.
that issue as well, Lois.